Hello, so we're continuing our tour of the exhibitor space at Best Practice 2024 in Birmingham, and Ardens has spared some of their time. So this is Laura from Ardens, who's going to tell us a bit about Ardens as a product and also the updates. So Laura, do you want to introduce the core functionality of Ardens and tell us what the core product is?
Yeah, definitely. So at Ardens, we've got two core products. We've got Ardens Clinical, which is essentially clinical decision support tools, so helping you enter data into the patient's records. And we also provide a series of suites of reports embedded within System 1 and EMS Web. And then we've got Ardens Manager, which is our newer tool, which is our population health management tool. So GP practices, PCNs and ICBs can use that for monitoring everything from your contracts to your service management as well.
Okay, good. Yeah, so I think most people are probably familiar with the core products. I know we use that a lot in Nottingham, and that drives a lot of people's recall and long-term condition management. But what's new to me is the population management tool. Maybe you can tell us a little bit more about that.
Yeah, absolutely. So on Ardens Manager, we've got about 23 dashboards, which range from everything from appointments through to long-term condition management, vaccination uptake. We also provide a cough dashboard, IF dashboard, and really it's a really good platform to use to monitor service delivery against all of those areas as well, keep on track of everything.
Yeah, good. And you had the privilege of being shown a bit of a demonstration of the new tool a few minutes ago. And what was quite impressive to me was that you were able to take the patient data about what they needed clinically, and then you were able to combine that with population health data from other sources, such as indices of multiple deprivation or other data that's held elsewhere, to enable targeting of health checks or other interventions at certain patient demographics or income deprivation levels. And that struck me as a really good tool for primary care networks or PLACE or ICBs that want to do health inequalities work, for example. So is there anything I'm missing there?
Well, spot on really. So yeah, we're really excited to announce we've just launched Ardens Manager version 2. So that includes patient level data within the platform, so you're able to now identify who you need to be actioning directly within Ardens Manager. And also we've got this further breakdown information. So for every single report within our dashboards, you've got the ability to break down that headline report into demographic information about those patients. So you can look at vaccination uptake, you can drill that down by your ages, your ethnicities of those patients, whether they're from an area of deprivation, like you say, so you can really focus on healthcare.
Yeah, it looked like that was postcode driven, is that right?
Yes, exactly. So we take the patient's postcode, we map it to their LSOA, what's their wider region, and then we map that onto a deprivation index, which gives us an indication of whether they're from a more or less deprived area. And we also look at long-term conditions as well. So out of all those patients that you're looking at in that headline report, how many of them have mental health, how many of them are frail, how many of them are end of life, diabetes, too.
So really, really exciting new development. So how are you finding Best Practice in general? You're having a good conference?
Yeah, brilliant. So we did a talk yesterday in the PCN Transformation Theatre, so myself and James, we talked about the new exciting launch that we've just done for Ardens Manager, but generally it's been really good, some really good engaging conversations, and great to create a bit more awareness about Ardens Manager and what we've got coming next as well.
Fantastic. And if we look into the future for Ardens, or just for general practice in general, what would you say you were excited about or saw as opportunities in the future?
Well, I think we've been spending a lot of time in the Ardens Manager side creating our kind of full core foundational blocks. So that means we're basically we've got really good foundations, we're able to spin up lots of new and exciting ideas, looking more into the recall elements side of things, making sure that's really efficient and streamlined, but also using the rich data set that we've got and pairing it with more data sources so we can create a really good picture of what's going on in primary care.
Good, so it sounds like interesting things coming in the future. Thank you, Laura, so much for your time today, and hope people have enjoyed the updates. So thank you.
No problem, thanks.